PSA, or prostate-specific antigen, is a glycoprotein belonging to the kallikrein family. It is produced by the prostate epithelial cells and deposited in the seminal fluid. PSA acts as a serine protease. It cleaves seminal shellin, a protein in seminal fluid. This process reduces semen viscosity, improving sperm motility. PSA has a half-life of approximately 2.2 to 3.2 days. Importantly, PSA levels are stable throughout the day and do not exhibit circadian variation. Androgens stimulate PSA production, making it androgen dependent. Now let us dive into the factors that can affect PSA levels. There's a lot to consider, so let us break it down step by step. Let us start with the conditions that can elevate total PSA. These include some common and some not so common situations. Number 1 on the list, prostate cancer. PSA levels are often higher in men with prostate cancer, making it one of the key reasons this test is used in screenings. Next, we have BPH. This is a non-cancerous growth of the prostate, but it can still lead to increased PSA levels. Infections such as prostatitis and bacterial cystitis can also elevate PSA levels. Note that antibiotic treatment can reduce PSA in nearly 30% of men with chronic prostatitis. PSA levels can also rise due to prostate manipulation or trauma. Think of recent procedures like a cystoscopy or urethral catheterization. Now here's one that might surprise you. Recent ejaculation can also elevate PSA levels. That's why it's generally advised to avoid sexual activity a few days before the test. And finally, let's not forget that PSA levels tend to naturally increase with age. This is a normal part of aging, but it's important to consider when interpreting test results. Now let us shift gears and talk about the conditions that can reduce PSA levels. One major factor is medication, specifically 5-reductase inhibitors like finasteride or dutasteride. These drugs can lower PSA levels by about 50% after 6 to 12 months of treatment. Medications aren't the only factors at play. Low serum testosterone can also lead to reduced PSA levels. This can occur due to conditions like hypogonadism, or as a result of testosterone-lowering treatments, such as LHRH agonists, or certain medications like ketoconazole. And let's not forget surgical and radiation-related changes. Prostate surgery, whether it involves removing or destroying part of the prostate, may initially cause a temporary rise in PSA due to trauma. However, with proper follow-up, PSA levels typically decline over time. The same goes for prostate radiation. PSA levels often spike during or immediately after treatment, but with longer follow-up, they usually trend downward. And lastly, hemodialysis and peritoneal dialysis do not alter total PSA, but they do alter free PSA. Therefore, free PSA should not be used in dialysis patients.